Good afternoon. I'm Jason Rogers, the Delaware County Emergency Management Director. Today is Tuesday, March 17th, 2020. This is today's briefing from the Emergency Operations Center. In coordination with the Delaware County Health Department, the following information is being provided. The Emergency Operations Center has been closed to all public access. It is currently activated in response to the COVID-19 pandemic. A briefing was conducted with the Indiana Department of Homeland Security along with the Indiana State Department of Health today, and I'd like to share with you not only some information from that briefing, but also local plans and efforts that are being conducted. The number of confirmed cases has risen to 30, and the death toll is now at 2. Indiana has just confirmed its first juvenile case of COVID-19 as well. It's important to state that none of those cases are within Delaware County. The state of Indiana has requested from the federal government an allocation from the Strategic National Stockpile. The SNS is a disaster supply of medical supplies maintained by the federal government. The current SNS request is for personal protective equipment, or PPE, to supply hospitals and healthcare workers only who are on the front lines. At this time, we have not had any information come back that the request has been granted or denied. In an effort to conserve PPE and make every hospital bed available, all elective medical procedures should be postponed. Please consult your medical provider if you have something scheduled already. At this time, there are no provisions from the state or federal government to supply citizens PPE such as masks or gloves. This is why social distancing is so important, and it's up to you to stop the spread. We are asking that all nursing homes, extended care facilities, and medical treatment facilities stop all visitation immediately. This is to protect the most susceptible population from an outbreak of COVID-19. At this time, we are asking only that end-of-life visitation be permitted. Because of the nationwide seriousness of this outbreak, testing for COVID-19 has become very difficult, meaning that the worried well are demanding to be tested, causing the shortage. Therefore, strict guidance from the CDC and the State Department of Health have been implemented to only test the high-risk and high-probability patients. This is ensuring that healthcare workers and critical patients only are the ones getting the test. I want to reinforce that there is no medicine or cure for COVID-19 infection. As more testing becomes available, plans are in place to make accommodations for those needs. If you are one of the worried well and concerned that you have come in contact with a person that is suspected COVID-19 positive, you should watch closely for symptoms, including cough, fever, shortness of breath. You should also self-monitor your temperature twice daily and maintain a record of those readings for your medical provider for 14 days. If you show signs of any illness, you should immediately self-isolate. Then use a virtual clinic to see a healthcare provider to get screened, and you can give them that information. This is, however, not a situation to call 911 if you come down with symptoms. The state of Indiana has suspended specific CDL rules so that supply lines for groceries and everyday supplies will continue in Indiana uninterrupted. At this time, lines are intact and we will continue to get supplies delivered. Please stop panic buying. The Emergency Management Agency is working with Second Harvest Food Bank to ensure that there are food supplies available free to the public. We anticipate having details for distribution points by Friday's briefing. Local government emergency plans are being activated, and private partners like Second Harvest are key to their success. Please look out for your friends and neighbors that may need this as a resource. Please also offer your assistance when and if you are asked to help. Your friends, family, and neighbors are depending on you. If you are well, please consider donating blood. We are in a severe need of all blood donations. Every community's supply in Indiana will be affected by this. Again, if you are not sick, please try to donate blood. You can locate a donation center near you at redcrossblood.org. That's one word, redcrossblood.org. And finally, there have been rumors of curfew and travel restrictions being put into place. These rumors are not true at this time. If the public will follow the CDC guidance and stop all unnecessary travel, visits, meetings, and stay home, none of that will be necessary in the future. Some counties are reporting on the travel advisory map. You should contact that county to see what their specific restriction is, because this is not a weather event. The next briefing will be held Wednesday afternoon. Thank you for your continued cooperation and patience. This is a massive national level response that is unfolding. Please refer to the Delaware County COVID-19 Hub at dcema.com for the latest local government updates. That will be all for today. Thank you.